Welcome, everyone. This is Tim Ashe, President of the Vermont State Senate, here with my daily update on Vermont's response to the COVID-19 pandemic. Yesterday, I had some technical issues. I had the governor on with me for a conversation about what it's been like behind the scenes for the state's leader to have to make a lot of these really difficult decisions. I've posted that video up on Facebook and on YouTube. I hope you will take a look and watch the video. I didn't ask him questions about the day's news or, updates from the health department or anything like that. It really was just trying to get the human picture of what it's been like in the days leading up to the state of emergency declaration, the shutdown orders for childcare, schools, and all that. And then on a personal level, what it's been like to have to endure day after day of really difficult news, hard decisions. And I enjoyed the conversation with the governor, and I hope you'll check it out. It was not a partisan discussion. It was really just trying to give some insights in what it's like to be in the governor's shoes these days. So I hope you'll check that out. Tonight, we have a slightly different perspective on the state's response to COVID-19. We have Peg Gagne, who's the Chief Nursing Officer at UVM Medical Center. Peg, thanks for joining me.
Thanks for inviting me.
Well, we know how much frontline workers have been stepping up during these times. They already have tough jobs, but during this crisis, it's just a whole nother layer of pressures. And so you may have direct contact with more people who are in that frontline universe than maybe any other person in a leadership role in the state as the Chief Nursing Officer. So I was hoping what you could do to get us started out is to talk a little bit about what it was like for you and your nursing staff in the days leading up to the first patients. Obviously the news around us was that, that there was a global pandemic that was heading our way. We started to see cases in Washington State and a few other areas, and we knew we would not be immune, to use a literal word, from the virus. But what was it like behind the scenes at the hospital, trying to ready the nursing staff and others? What were they anticipating? What were you anticipating? Why don't you shed a little light on what it was like in those days leading right up to the first cases in Vermont?
I think I actually took a vacation early in March. Came back, it was the very first week of March that I got back, and the world was different at the hospital when I returned. Prior to that time, we were definitely thinking about the coronavirus and what impact it might have, and had some planning teams in place. But it was a full court press from the beginning of March for staff and leaders across the organization to get ready for this, and just the level of energy and engagement and intensity around the decisions was huge. And I think for nurses, looking at the experiences that others were having from the news and not knowing what our experience would be like, we were planning for all of it. Did we need, the crisis beds? Did we need additional critical care beds? And what kinds of processes and protocols and all of those things to support the care at the front line would be needed. And so there was certainly a level of intensity and also anxiety. Our nurses hadn't practiced in this kind of scenario before. And so they were worried, and we were worried, and we were getting as many things in place as quickly as we could to deal with that.
Now, were nurses anticipating the kind of surge that has overrun some other hospitals across the globe and sometimes in our country? I mean, was that the sort of the so-called water cooler topic?
Absolutely. And, when we looked at projections and kind of where we started, and then as the state came in with the stay-at-home guidelines, and, I think that came on earlier than other states, that started to, people were settling their shoulders a little bit and taking a breath, but we still didn't know what our experience would be like. And we were thinking that, by early to mid-April that we would be exceeding our capacity. And so we had all kinds of plans going on to be able to meet the staffing and the equipment and of course the PPE needs that would present. So it was there weren't any easy decisions those
No,
days. So
I bet not. Obviously, the hospitals are, they are trained and you prepare for all sorts of eventualities. I worked in senior housing where pandemic, flu, and similar public health crises, we would plan for what to do under different situations. When this one came along and it seemed like it was real, not just a simulation, was it like all systems go? Everyone was ready to transition right into executing a plan, or did it becoming real highlight some gaps in terms of the difference between just planning and then actually having to do it?
I think what I saw was more the all systems go. I think we pulled very quickly together into an incident command kind of structure where we had point people on operations and what the clinical care and practice would be like, and logistics around PPE and our supply chain and what the facilities work would be. And I think it was really all in. I think there were teams down in the ED figuring out patient flow and building all kinds of structures outside to support different workflows. And so I really think that, when the going gets tough, the tough get going. And it was all hands on deck effort in those earlier weeks.
When once, the new normal started to sink in and we were in week 1, week 2, week 3, when the patient counts started to rise, what were some of the worst fears or the most extreme scenarios from the point of view of the nurses you work with? Did things bear out the way things had been anticipated, or were we able to head off some of the worst case scenarios that nurses were expecting, both in terms of the sheer volume, but also in terms of what was going to be required of them, on the job?
Yeah, I think we were to a large extent, and a lot of it had to do with the state response. So really, keeping people with the social distancing and sheltering at home protected everyone and actually saved lives in terms of, the numbers that we had to deal with did not grow exponentially. They came in, there were weeks when we were up when our medical intensive care unit and our general care unit that had both totally converted over to COVID care were full. But we got there somewhat in a stepwise fashion. And so it gave us the opportunity to really, almost overstaff initially, give people some comfort in the new procedures and the, time to put all their PPE on and off and really have that really education time and learning time as we started to, ramp up. So I think that helped a lot.
One of the things that sort of is behind, well, I don't know how to quite put it, but lurking beneath the surface in most people right now is a generalized anxiety, a sense that even when we're safe at home, there's something lingering, that's unsettling. And, I don't know if it's a fear factor or just something, it's worrying, obviously, and concern for our own health, but for people around us who might be in vulnerable settings.
Yeah.
You staffed up, and that allowed for a certain cushion in those early days. Did you have staffing issues as a result of nurses and others in the hospital who'd come in contact with people who tested positive and needed to isolate or quarantine? Did you ever run into that kind of problem?
Yeah, I think we certainly had staff who were exposed in various ways and then needed to quarantine at home. It never really rose to the level where it impacted staffing. We in terms of the way that staffing was impacted, I think, first of all, for staff on those COVID units, the care that they were delivering was totally different than what they, it's a different patient population, it's different sort of care needs. And so, they needed to learn how to clinically manage those patients, and the protocols, because the coronavirus is new and we're learning more about it as we go along, some of the protocols changed as we, went through the past 2 months. And so having to, constantly adapt and change what you're doing, I think was one of the stresses on the staff. Certainly in order to maximize the census that we could accommodate at the hospital and also preserve our PPE, we did end up closing or, scaling down all of our elective procedures and, kind of cut back to just essentials. And so that certainly did impact work hours for a portion of our workforce and changed, instead of working in a clinic, they might be home doing phone calls or taking additional time off. And so I think that has had an impact, and we've tried to have choices for people around that. But I think that's also been difficult. Many of those folks that might be in clinics or areas like endoscopy where they are perioperative services where they're not running full bore right now, we have tried or did try to divert to other activities like screening at the door or answering hotlines or, those kinds of work opportunities to keep people as close as we could to their work hours. So.
Well, I can imagine, nurses in particular, but all the people who work in healthcare in a direct care setting there's an inherent risk that comes with it in terms of infection and injury. This one slightly different in that the risk of infection is very serious. Vermont's nursing workforce is not in the age range of the most vulnerable to the worst symptoms of COVID-19, but we have an aging nursing workforce as a general rule across the state. So wondering the extent to which this particular health crisis has impacted the personal side of the nurses' work lives in terms of, I see the brave face on nurses every time I've been at the hospital. Mm-hmm. How has that impacted them just in terms of readiness to show up every day and do the job, in terms of having to separate physically from family members? I mean, we see doctors sleeping in tree houses in some places. How's it disrupted home in terms of, connections, being around kids? Can you say a little bit about that?
Oh, I think it has. I think, it's because this has impacted everybody's life, both work life and home life, that's a level of disruption, so there's the, now the homeschooling that needs to happen at home or, worry about elder parents that might be close by or in the home and supporting that. And I think we've certainly seen that with our staff. What am I going to be bringing home if I'm, getting groceries for my mom or something like that? We have really tried to be so solid in terms of focusing on the safety of our workforce and providing PPE and everything that they need to do their work safely here. But I think we've also tried to support them with housing options if they don't feel comfortable going home.
And have some of the nurses taken the hospital up on that offer?
Yes, they have. So it hasn't been huge numbers, but I think, it's probably maybe around 20 or 30 folks that have done that. So
I know that some healthcare professionals in the state have tested positive. I don't know the extent to which the health department has revealed where those workers were doing their work. Mm-hmm. If you're not able to speak about it, then I understand. But is it a matter of public record that any employees at UVM Medical Center have tested positive?
We have had 30 employees that have tested positive. The majority of those exposures were not at the hospital from what we, in terms of history. So there was either a travel history or it was within their home or something like that. So it was only a small percentage of those 30 that we couldn't identify, the exposure. And I think there's 28, all the employees, none of them were hospitalized. And I think we have 27 or 28 that are back to work at this point. So.
Well, that's certainly great news. I know that some of your staff were enlisted to go to Birchwood Terrace, which was a facility that had an outbreak, and I think they were in desperate need of support.
Yes.
How quick was that turnaround once they had their outbreak that UVMMC staff were there helping support them?
Well, I think we heard maybe it was a Wednesday or Thursday, and we had a call for staff to come in Friday afternoon. And so I think we started providing some staffing support for them on Saturday, direct care support. And then it transitioned through that next week to a point where we accepted some of the Birchwood patients here to offload them a little bit. And at that point, their staff were able to take over the direct care pieces. But we have had our palliative care team in there since, I think it's been 3 weeks now, going on 4, and to help support the staff with the care needs of those patients that are there. And we had, I think, 6 nurses that volunteered to join and support that team over there. So they're consulting and educating the staff on, palliative care strategies and techniques. And so.
Well, it's a great spirit of collaboration. Obviously, 2 different entities, 2 different employers, but clearly a facility in need of help in that moment. Yes. Going just like Burlington Health and Rehab, going through just the most challenging time maybe in their history from a health point of view. And
absolutely. And I think, it's been really inspiring, I think, for the team to work with the Birchwood staff and residents and get such a view into how they regard that as their home and their family, and really wanted to, we had offered to take more patients over here, and they really wanted to provide the care that they could and keep those folks in the home that they were used to, and so on.
Well, it's certainly good news that you guys were all able to kind of piece together the staffing needs, because I know that the medical director for Burlington Health and Rehab, different facility, but listening to him speak to a legislative committee about maybe 3 or 4 weeks ago was some of the most painful reflections on this crisis that I've heard. It was really, on a human level, just really brutal. So
yeah, I think our long-term care facilities and need a special focus as we go forward to just keep them as protected as we can, because
that raises an interesting question. Obviously we have a sophisticated medical system, UVM Medical Center being the most being the, I don't know, in your business, you have the term for how it's distinguished from the other hospitals. It's an academic medical center. It has a level of, I don't mean to say sophistication, because it makes it seem like the rest are not sophisticated, but its level of complexity being on a slightly higher order. So there's a lot of preparation, training, but do you think this experience is going to lead to any changes in the way either nurses are trained in terms of planning for how UVMMC nurses will be deployed differently in the future if something like this happens? For instance, I was reading in the Washington Post, one of the potential worst case outcomes is that when the flu season starts up again in the winter, that the combined effect of COVID-19, if there's not a vaccine or more testing in place, plus the flu, could result in another surge in different parts of the country, which could mean Vermont having to redeploy some of the strategies. Wondering if you think it's changed anything for how nurses are going to conduct their business and their work assignments moving forward.
Well, I think, that maintaining readiness for any kind of surge needs is absolutely on our radar as something that we need to focus on going forward, because we don't know, what'll happen with flu and all of that. And I think there was a great plan that was put together when we were thinking about the Patrick Gym as a location for providing care, and how, the equipment is a little bit different, the documentation is a little bit different. We need to think about how to deliver care when you don't have all the conveniences that you have in a medical center like this, and be creative and flexible. And so I think setting up that Patrick Gym and thinking through the care needs there, and how we would manage that, has put us on a good footing to, be ready for that kind of eventuality. And then I think the other thing that's going to happen is that the care that we're providing now, we have been pushed to do telemedicine to a new degree, and those televisits. And I think that's a piece that's going to stay with us and be expanded, so we'll also be looking at how that impacts nursing and provider care going forward.
I know it's been a slow process of adopting telehealth and telemedicine in Vermont over the last 6 to 8 years. And on the legislative side, we were passing flexibility for more telehealth and telemedicine about a month and a half ago, in desperation mode. And it's probably, as you say, accelerated everyone's thinking of and appreciation for how it can be deployed in a way that has real value in terms of the patient, clinician experience.
Yeah, absolutely. I think it, put our foot on the accelerator a little bit. Yeah. That's a good thing, because people are experiencing and learning what it's like and what the possibilities are. So
yeah, it's an unfortunate way to have to hit the accelerator, but it was the circumstances that chose us. Mm-hmm. I got 2 more questions. The first one is, I know many people have, that many people wish to thank nurses or others who work in hospital settings, mm-hmm. and you have a online message board. I know that, mm-hmm. but if someone were to, if you had a friend or acquaintance who said, I want to express my gratitude to nurses, what would be the thing that you would tell them to do?
Well, I think the first thing I would tell them to do is maintain their stay home, stay safe orders in place. And
that's a very good public health message from you.
Right. Pay attention to what the governor and Dr. Levine are saying in terms of that. I think certainly the website, the cards, the gratitude that comes through there gets shared with staff, and that's a great thing. We did put a call out for donations for cloth masks and PPE through the College of Medicine, and that's another way to help.
Okay. Well, I think it's going to be a steady parade of thank yous over the coming months when we're on the other side of this and people can be outside. I mean, it'll be nice to see people standing outside the hospital thanking and in a celebratory mode, or a moment of gratitude rather than other reasons.
Yeah, and there's been some nice signs appearing out there in the entryway, and I think that's been appreciated.
Yeah, I was running on Colchester Ave recently, and I saw a biker just kind of cycling around with a nice sign on the back. I don't know how many nurses or others were able to see him from the hospital, but it was the thought that certainly counted.
Yeah.
Last question before we wrap. You've now been, this is about 7 or 8 weeks when you probably all in, maybe with a little bit of planning on the front end, that you guys were experiencing, but members of the public weren't. Any particular moments that stand out, where you were particularly proud of the team you work with?
I think there's a few things that stand out. I think I've had the opportunity to be on a video call with the group that is providing care out at Birchwood. And I think talk through some of the challenges and the logistics that they were dealing with, and how, how we could support them differently or better. And just seeing their faces, so committed, so engaged, bags under the eyes a little bit for the time that they had been putting in.
Yeah.
It's pretty moving. I think across the board, I'm just so incredibly proud of the nurses and the other care providers. Respiratory therapy, I remember I rounded down in their break room a couple of weekends ago, and they're sitting there, taking a break and relaxing a little bit. And just the imprint of the N95 masks that they have to wear all day long, on their faces, and just still engaged and excited about the work and committed. So I think that's been great to see. And I think there's such a sense of people taking care of each other here, their colleagues, and we've had units that maybe have been not front and center. The NICU set up sugar crash carts, they're calling them. Crash carts are what we use at a code or but these were sugar crash carts for each of the units that was providing COVID care, with all kinds of goodies and things like that for people to use to kind of refuel. And so there's been things like that. We've got a great wellness team that is looking for ways to support the teams on the front lines. And so.
Well, it's terrific. I know someone who just had a baby at UVM Medical Center while all this was going on. It was not a straightforward delivery, and just described it as an amazing moment with all else going on and the sort of insecurity and anxiety about it, but felt so well taken care of. So I want to thank you. Peg Gagne, who is the Chief Nursing Officer at UVM Medical Center, your whole team has really stepped up, done amazing work. And we know we're not through it yet. I think your encouragement for people to thank nurses by following the stay-at-home order and the orders from our Commissioner of Health, I think, are well placed. And so I would encourage all watching as well that that's probably the first and best thing you can do to thank a nurse.
Right.
And then we'll have plenty of more opportunity to show our gratitude in the days ahead once we're when we're on the other side of this, because there will be another side of this. And so Peg, thank you so much for all you've been doing. And on behalf of the state Senate, which is what I can talk about, please make sure that your nurses realize how much we're appreciative of everything they're doing, and hope you continue to stay safe too.
Thank you very much for giving me the opportunity to kind of showcase the hard work that all of our staff and it's my pleasure. You have the hard job. I've got the easy one of asking you questions. So thank you so much, and stay safe. Yep, you too. Bye.
Bye-bye.